Okay, so Dr. Andy Young over at St. John's here with Officer Stewart, and we're just going to take a little bit about your history. And so you had your hip replaced about 15 months ago.
Yes.
But you had been living with this for a long time. Tell me a little bit about what it was like dealing with your arthritic hip.
Well, the symptoms began about 6 or 7 years ago, and I had started off with small pain. I was always a very active person, and so it would hurt me when I would during periods of activity, like at the gym, or when I was out for my runs. As the years went on, it started hurting me just doing everyday activities, like getting in and out of the car. And it got to the point where just getting out of bed and going to the bathroom in the morning, my hip would be hurting. So it severely impacted over a period of about 5 years. I went from it just hurt when I exercised to hurting basically all the time.
And we were talking a little bit about this earlier. How is that affecting you mentally or your sense of well-being?
It actually changed my personality. I was in so much pain, and I didn't even realize how much pain I was in. That and it comes on kind of slowly over a period of time. You don't even realize it. You're in denial. It wasn't really till people around me inspired me or encouraged me to actually go see a doctor and seek medical attention. I was actually turning into a different person, like my personality, just because of the level of pain that I was enduring all the time. And I didn't realize it, but just the quality of my life was deteriorating. I was I couldn't work out anymore. I couldn't exercise anymore. So I started gaining a little bit of weight. I was irritable. I couldn't sleep at night. So the pain in my hip carried over into all areas of my life, and I didn't even realize it until my wife, of all people, encouraged me. She says, you really, I guess she saw it in me. She saw me changing my personality. It wasn't me. You need to go see a doctor. And that was about 15 months ago. And having gone through this whole process, I'm a completely different person. Just completely.
So is that what triggered it? So you were putting up with it. You got a high pain threshold.
Yes.
But it was really your family saying, you got to take care of this.
Yes.
Okay, that was the trigger. Now, what held you back for all those years? I mean, you knew something was going on.
Well, this is, for me to admit this, because I'm a big police officer with the Los Angeles Police Department, it was fear. It was fear of the unknown, fear of the pain, all the things you hear about, and how major of a surgery that is, how intrusive it is. So it's all those things. To boil it down in one word, it was probably fear of just not knowing what to expect.
Fear of being vulnerable. Fear of outcomes, fear of risk, all that stuff.
Absolutely.
It wasn't working very well, but at least you knew what it was.
Correct.
How'd you work through that fear?
It just basically got to a point where I couldn't function anymore, and I had no choice.
So the dysfunction passed the fear.
Yes.
Okay.
Absolutely.
So when fear was higher, you could hold off.
Yes.
And then the dysfunction passed the fear.
Yes.
And then you had to face it.
And I had no choice.
Okay.
Yeah.
What was it like then? Right. So you're 15 months out. Was it what you expected? What were some of your impressions of recovery, and then now when you're beyond recovery?
Well, this procedure has exceeded my expectations. I told you I was 100%. I feel even if there's such a thing, I'm beyond 100%. The quality of my life is returned. If I ever have a problem with my right side of my right hip, the right side of my body, I'm not going to hesitate. I'm going to come right in and get it done. It's because of the quality of my life is so much better than what it used to be. That I'm 55 years old. I feel like I'm as good as I ever have been. I mean, that's what kind of results that I have and how I feel. And
did anything surprise you just about the recovery process? Was it worse than you expected, better than you expected, what you expected? What are some of the things that you would advise people to be aware of as they go through recovery?
Well, surprisingly, the first thing I would say is don't fear this procedure. And it actually wasn't as bad as I conjured up in my mind. The recovery and the therapy, and it was very straightforward, and I found the pain to be very minimal. And the recovery time, the time it took me to get back on my feet and to resume my lifestyle, I have a very active lifestyle, it even surprised me, it shocked me.
When did you get back to work on the force?
About 3 months after
after
surgery.
Was that a good amount of time? Was that the right amount of time?
Absolutely.
where you felt like you were safe doing the job?
Yes.
Okay.
Yeah.
Okay, good. You know, as you're thinking about young guys, because, you know, we talked about this, it is hard for young guys. My older patients, they can accept that their body is changing. My young guys really struggle with this. What would you advise young guys dealing with this?
To stop being in denial, and if you have these symptoms and it gets to a certain point of uncomfortableness, or it impedes your life or impacts your life,
Yeah.
you know, you need to seek treatment and you need to deal with it, because you think you're doing the right thing by putting it off,
Yeah.
and you're not.
Huh.
You're not training like you could be training, and so basically what it is you're wasting time, because the end result, if you're a candidate for hip replacement, you're going to have your hip replaced at some point, and you're not doing yourself or anybody around you, your loved ones, your employer, you're not benefiting by putting that off and postponing a procedure like that. So my advice to younger people who are invincible,
Yeah.
we're not invincible.
Sure.
And you know, because I went down that road. I thought I was invincible. I didn't need that. I could work through it. You're not going to be able to work through it. But you know, the good news is there's nothing to fear, and the results are amazing.
Yeah.
And like I said, I feel like I'm 100%.
Yeah.
And it's been fantastic.
Yeah. You look great. You look
Yeah,
like a
thank
different
you.
person too.
Thank you.
Well, I know that being vulnerable is not easy, especially in front of a lot of people.
Right.
So thank you for sharing that.
You bet. My pleasure.
Thank you, officer.
Thank you.